Being an organ donor is one of the most profound gifts you can give.
During the days after Hurricane Sandy, as you know, many of our healthcare facilities were without power and running on generators. One story from Newark Beth, Israel included a plane traveling to the Midwest to bring a heart to a New Jersey resident here in New Jersey.
Just another day for Dr. Margarita Camacho, who was on her way to procure a heart for the second heart transplant of the day.
I always tell people that I'm very well suited for this job, because I love it. I really do love what I do. I'm very fortunate. But I also can survive on cat naps.
In most programs, procurements are actually done by cardiac surgical residents. Newark Beth Israel is quite a bit different because Dr. Camacho actually goes out and procures pretty much every organ by herself.
Initially, Camacho's career path was headed down a different road. She wanted to be a teacher. Her love of the sciences took her to pursue a PhD in pharmacology until a professor suggested she head in a different direction.
And he said, you know, there's a compassionate nature about you that I've noticed. Father, I should tell you that you should really consider medicine. When I was in medical school, I obviously I didn't know what I'd be, what career I'd choose, whether it be in medicine or surgery. But when I did my clinical rotations, a surgical bug bit me, and it bit me really hard. Well, we're going to go procure a donor heart. The flight will be a little under an hour, and we're going to be working with other teams. The abdominal team will be recovering the liver, the kidneys, pancreas. I'll be recovering the heart. And when we're all done, we're going to rush back on this plane, back home and implant it.
Over the past 8 years, and ever since she arrived, the program has grown at a nearly exponential rate.
Everything just moves so efficiently, and it's because of all the amazing people on our team that we've been able to achieve the success. When I decided to become a surgeon, my parents were great. They were very supportive. My husband, who's also a physician, was very understanding. Both of us have the same view about our lives in medicine. We really love what we do. There's just nothing as gratifying as taking care of the patients we take care of.
Chris Russafara's brother was an unlikely 20-year-old recipient of a heart transplant in 2011.
After the surgery, the whole family is waiting in Kimberly's room. A really great place for the families of transplant patients to hang out. And Dr. Camacho comes up and she's smiling and she's happy and she expresses how well the surgery went. And you know, I've never really been starstruck before in my life, but she walks into the room and I'm like afraid to shake her hand because I know they do God's work.
Bob Delafave was feeling sick and retaining about 150 pounds of fluid when he was rushed to Claramas Medical Center. Upon the realization that he had a cardiac problem, he was sent to Newark Beth Israel Medical Center, where he was diagnosed with constrictive pericarditis, a disease which inhibits the heart from fully expanding. Dr. Camacho and her team completed the surgery to alleviate the initial problem and also repaired a hole in his heart.
We had always discussed the possibility of having children, but when I became sick, we definitely wanted to wait until we found out exactly what I was dealing with and what the prognosis was.
In April, Dr. Camacho received a letter from Delafave, expressing his appreciation.
I feel like I've been given a second chance at life thanks to you, and I have used that opportunity to bring two beautiful new twins into the world. They were born on December 27, 2012, and their names are Evan Bryce and Scarlett Margarita. Yes, we chose the name Margarita to honor you because without you, they would not be here, and neither would I. It's the smallest token of our appreciation to you, but she will carry that name with her proudly and will forever know of you and the role that you played in her being here. But I hope when you look at the faces of my babies, you can begin to understand my level of gratitude.
She is an outstanding ambassador for the field of transplantation and is unbelievably personable and very well liked by the community as a whole. And I attribute a lot of our growth to Margarita's personality and outreach efforts.
There are so many successful patient stories. And it's when you look at these individual lives that your life is touched and you realize the importance of what you do every day.